Do you know what the Frenchie Sploot is? I'm Laurie McCauley from Optimum Pet Vitality. I'm going to introduce you to Bromley, show you what the Frenchie Sploot is, why it was causing him problems, and how we fixed it. So the first thing to note is Bromley is a 5-year-old neutered male Frenchie who came to me with a partial ACL sprain, so a partial tear. And it was healing, which was great, but he was still having problems. And his mom is super. She's a physical therapist, and she said, I really think he has some SI issues. And she was right, and we'll show you why. The other thing, very interesting, is his tail. If you got really excited, mom or dad came home, it would go ding, ding, and that was it. We fixed that too. So let's look. What did we see? First of all, we see that his leg actually almost bows out. Look at his foot placement. His knee is super, super straight, as is his hock. And when we look at his posture, he's going up, not a flat top line. That puts stress on the back too. How does he sit? When we look at this, look at that leg way out there. It's externally rotated, it's out to the side, it's not under him. And if we put him on a flat surface on the floor, he would slide back and out. Very little abdominal strength. We needed to fix that too. When we had him sitting at home, this is the Frenchie Sploot, he would actually sit on his knees. Not good for his knees. It hyperextends his hocks, which puts more stress there, and it puts his back into hyperextension, causing him to have lumbosacral and SI issues. But we fixed it. So what did we do? We used our laser, and we lasered his SI, sacroiliac joint, his lumbosacral joint, got rid of the pain there. We did both knees, right? Because even if we only have an injury to one, there's probably inflammation in the other. We did his tail and did some traction. That we got our waggle back. We did his neck. I think that was secondary issues, and he's a Frenchie, so they have a tendency to bang into things. We did acupuncture. He loved it. He fell asleep. And we did chiropractic and manual therapy. But let's talk about the exercises. We had him sit up straight, and we don't fix his feet for him, because that's like saying to somebody, go clean your room, go clean your room, go clean your room, and then I do it for you. You're like, yeah, don't have to do it. Whereas if we tickle the outside of his foot and say, fix your foot, and they have to keep doing that, they're going to learn that that's kind of annoying, and so they do it themselves. It becomes a habit. We also placed his foot externally rotated, so then he's like, I don't like that, and he brought it back in to strengthen the muscles to help keep it internally rotated, or at least straight. And then rhythmic stabilization. That's where we push them, and they push back, because he's a Frenchie, and that's what they do. And that works his trunk and his legs. We did 3-legged stands. So we had him stand square, and we would pick up one leg, and he'd kind of wobble a little bit. But again, it's strengthening all the muscles around his joints and his trunk. We tried sit up and bag, and he almost fell over. We caught him. He's getting better at that. And then we did sidestepping. So I want to show you this. Actually, we did it first on the floor, and he's such a Frenchie. We tickled the inside of one foot to step out and the outside of the other foot to step in, and he sat down because he's a Frenchie. So then we did it on a table, kind of outsmarted him a little bit, and we taught him how to sidestep so that he could work on the muscles to bring that leg in. And we did it in both directions. So where is he at? He can now sit square. His mom sent me a picture that showed him sitting nice and square with his legs. It's wonderful. He no longer does the Frenchie Sploot. He can wag his tail, which is really good. He no longer slides back. He's playing more. He's happier. He can play with his brother Brayburn. Get the apple thing? Bromley, Brayburn. It's very cute. And his posture is continuing to improve. So we're getting him to bend his knees a little bit to take pressure off his back so it doesn't come back. So if you're a vet or a technician and you want to learn more, see cases like this, pop on to Optimum Pet Vitality, where you can find my laser course, Optimum Laser Therapy certification course. It's 19 hours of race-approved continuing education. Great. And if you just want to see more videos like this and learn and have fun, join me, follow us, subscribe to us on YouTube, And you can see more videos and click here for the next one. Have fun. I'm Laurie McCauley from Optimum Pet Vitality. We'll see you soon with the next Learn and Go with Laurie.